on her end.
They would be surprised by how legs. Our arms had.
I'm not even gonna look at you because you messed me up last time.
Here, just move the curtain a little bit. Just shut her out. We're gonna have class now, okay?
Yeah, no kidding, okay?
Okay,
I can't see
I'll
either.
try to be normal.
See, that's why your head is forward. Is that stupid shelf?
I know. This is too long to sit here.
Okay, we're now serious. Okay, is it okay if I get your face up, my friend? Okay, so these ones are we're not going to be tested on these. So let me see. So this is the page. You guys can go to page 40 and 41. So radial nerve. We're going to put the tension on the radial nerve. Internally rotating the shoulder, flexing at the wrist, and pronating at the elbow, like this. Median nerve, external rotation of the shoulder, extension of the wrist, and like this. So as with me, I was negative right here, but I did test positive in this. So you might want to abduct the shoulder just a little bit. And make sure the elbow is straight as well, like that. Ulnar. You can add a little bit of abduction with your quads. That's it. Okay, what's that going to do? What's so funny? Oh man. Guys, we need medication here. Is it okay if we get your face up?
I am face up.
Oh no, face up. Sorry, I'm sorry. Okay. So we're going to do the medial and lateral collateral stress test of the elbow. So what does the medial collateral ligament do? Supports the elbow. And the lateral one, so it doesn't shift. Should have a little bit of give, roughly 5% or roughly 5 degrees. So when we're stressing it laterally, so when we're moving the arm laterally, we're stressing the medial collateral ligament. When we're moving it medially, we're stressing the lateral collateral ligament. So medial collateral ligament is about 5 degrees. That's fine. If it's over 5 degrees, it's positive. Does it hurt?
Yeah, it looked like it did.
No?
Yeah.
And then this way. So a little bit of movement is fine, but if it's above 5 degrees, that's a positive test. So once again, guys, medial collateral, lateral collateral. Now, make a fist. When we're extending, we're firing the extensors. They attached at the lateral epicondyle. So this is going to be our lateral epicondylitis test, aka tennis elbow. So you're going to grab the fist and tell them to extend against your resistance. So give her. And how's that?
Good.
If there's pain, it's a positive test. Exactly the opposite for the tennis elbow or medial epicondylitis. Tell them to flex the wrist. Yep. Any pain?
No.
Again, make sure that people always want to flex at the elbow.
Just that.
Yeah, tell them not to do that because you want to isolate at the wrist here, and you just try to support their elbow when you do it. So do it again. In reality, you'll be doing it like this when you'll be standing like this. I'm just showing it to demonstrate to you guys. So do it again. Any pain?
Sorry, I did start to.
Have a little bit of pain?
No, I was doing
Oh,
this.
okay. So go again. Any pain?
No.
Okay, so it's a negative. If there was pain, that would be a positive. And then there's what? Tendon sign. So again, review of our anatomy. We have the medial epicondyle and the olecranon. In between there's a groove, and that's where we're going to find the ulnar nerve. That's basically the funny bone. So, find it's easier when you flex the elbow a little bit. You can do a little bit, just about that. And then find that groove. So where are we? So it's olecranon, medial epicondyle. Here's the groove.
Nothing. You got it the one time.
Isn't that to test your funny bone?
Nothing?
No.
Nosing?
And then let's go the other side. If there are any neurological symptoms, that's a positive test. So again, medial epicondyle, olecranon. In between them, testing positive?
No.
No.
That was up
No.
higher.
Good.
Isn't it here?
Any questions?
So if you get one little zing off that, like, because it just hits in the right spot, is that?
Not necessarily. If it's very sensitive, that would be a positive test.
Oh, okay. So
Yeah.
like with every tap, it's. Just
Yeah, like if I hit it enough times, I will get some neurological symptoms, but that's probably normal. But if it's just like
Test your
every single
Hmm.
yeah, maybe I'm a little bit borderline, but yeah, if it's very sensitive, that's an indication for a positive test. Yeah, any other questions? No?
I don't think so.
Okay. Oh, we also did. I don't know if you were here. We did shoulder. We did rotator cuff. Were you here for that?
No.
You weren't here for that, were you? Okay, let's do those as well. What page would that be, guys?
30 something.
I think it's 40. No, not 40. It's 30 something. You're right.
Yeah, 30 something.
Okay, let's start with.
Is that the hot? No.
Yeah, let's start page 34. So biceps brachii test. So, again, it's one of those where you want to make sure that they're not curling. You tell them to abduct the shoulder this way. So basically, they want to be doing this, and you can show them to do that. You're gonna support underneath the elbow. Make sure they're not flexing at the elbow, and then your other hand at the wrist, and tell them to go up. Any pain?
No.
Okay. So the pain would be right here. Oftentimes, people will come in and they will think they have a rotator cuff issue. They will think they have a shoulder issue, but sometimes it can be actually the long head of the bicep. And again, oftentimes what happens is people will have poor posture. They will develop an impingement syndrome, the supraspinatus. The supraspinatus starts to inflame, takes up more space in the shoulder capsule, in the subacromial space, and then the next guy to oftentimes get hit because of that inflammation will be the bicep long head. So a lot of times they will test positive for this, and then they will test positive for supraspinatus. So we have two tests for supraspinatus. One's a simple one. Basically just go like this. So you can just go like that. And once again, you're going to tell them to go upwards like that. But against my resistance. So
Oh, okay.
you'll be... So just go up. Any pain?
No.
Okay. So if they had any pain or any kind of pinching sensation, that would be a positive test. The second one is called the Hawkins-Kennedy. So you got to be incremental with this one because people can be sensitive. Start off like this by putting your hand on their shoulder and then ease off. So he's stiff. A lot of people will actually drop down and go like this. And you got to be careful when you ease off, because if it drops too far, it can actually hurt their shoulder a little bit. And especially if they're hypermobile, it could actually cause a dislocation if it's bad enough. So start like that. Let ease off. Is there any pain? Any pinching in the shoulder?
No.
Second thing you'll do, you'll press down. Any pain?
No.
Now you'll get him to press against you. So press up against me. Any pain?
No.
So that's negative, negative, negative. Let's try this side. Same thing. And right here, ease off. That's fine. No
Yeah.
pain.
No.
You can always look at their face as well.
Resist?
Yeah. Is there any pain when I do that?
No.
Okay, now resist. No pain?
No.
So that's a negative. So no supraspinatus impingement, but oftentimes, like I said, when they test positive for bicep brachii test, they oftentimes will also test positive for supraspinatus. That's what I've noticed in my practice. What else do we have on there, guys? Infraspinatus and subscapularis is not in there though. So what you guys have in there is infraspinatus strength test. You can also use that test to see if there is tendonitis in the infraspinatus. So infraspinatus is the second most common tendon to actually tear in the rotator cuff muscle. So basically, you're gonna go like this, lock in your elbows. So oftentimes when I do this test, when they start externally rotating, what they'll do, they'll start doing this. Make sure they don't do that because you wanna. Is everything okay?
Yep.
Oh.
I was just repositioning.
No. You wanna make sure you're isolating the infraspinatus. When they're doing this, you're not isolating the infraspinatus. Just make sure they're doing this. Just pure external rotation against your resistance. So you put your hands on the outside of their hands right here, and tell them to externally rotate. Any pain?
No.
Simultaneously, you're checking for strength. You're seeing if one side is stronger than the other, and you're seeing if there's overall weakness. So if there's no pain, it's even, then it's basically good. The opposite test of that, what's the antagonist of the infraspinatus?
Or subscapularis.
Subscapularis. So okay, check this. And just the opposite. So go inwards, internally rotate, make sure that their elbows are locked in. And then you're assessing for strength, seeing if it's even, and if they have pain. If they say they have pain in the shoulder, which is rare for the subscapularis at least, then there might be a positive test for tendonitis or perhaps an impingement. Is that it? Is that all we had?
So, that is it.
Okay, so basically let's just do a quick review. So I would start off when they come in with shoulder pain. I do start with the bicep. You can start with the supraspinatus, but the reason you're doing the bicep, why? Because oftentimes bicep tendonitis can present in the shoulder. That's oftentimes the case, and people think that they have issues with the shoulder, but it's actually the bicep. So you go like this, tell them to resist, tell them to abduct upwards like this without bending at the elbow. How's that?
Good.
Good. Check the other side. Upwards. Nothing. Tell them to go up against your resistance. That's good. Do the Hawkins-Kennedy. Ease off easily. Press. Tell them to press against you. Press against you. And then tell them to tuck in their elbows like this. Tell them to go against resistance outwards, externally rotating. And inwards. And that's basically my little shoulder assessment, and I think it corresponds well with the book. Any questions?
Yes.
Yes.
When you talked about externally rotating, you said this. It's not this, right?
It's this, yes.
That's what I thought.
Yeah, yeah.
Right.
We're not supinating the forearms, we're externally rotating. And that's the thing. A lot of times people think it is coming from the elbows or from the hands, but it's not. It's actually purely from the shoulder. If they're doing this, then yeah, we're not isolating the infraspinatus. So.
Drop arm. Did we do drop arm?
No, not yet, but we will. Any other questions? Okay, awesome.